How do we support the community of public health professionals? Let's talk about it on this episode. You're listening to the PHEC podcast, episode 225. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. Now, this episode was recorded during one of my LinkedIn Lives. In fact, I intentionally set out to do my LinkedIn Live and cover this topic and see if it would work out to where I could share the audio from that video file in this episode. I don't normally like to do that, but I have done it a few times in the past when I really felt like the message was strong enough and important enough to share on the podcast as well. And this is one of those times where I wanted to share the message on multiple platforms. So I shared it on my LinkedIn Live and a few other social media platforms. And then I also repurposed that audio for this episode. So you'll hear me refer to something about the video or leaving a message in my LinkedIn direct messages or commenting below or things like that. If you could just be a little forgiving, I would appreciate it. I really want to be able to have you focus on the message. And what I'm doing is sharing with you some of my takeaways. I spend a lot of time paying attention to my audience and my community. And if you've been around for a long time, you know that I do this. I pay attention to what my community is talking about, what is needed when people reach out to me. I pay attention because that is an indication of a way that I can step up and serve better or where I can bring more resources to you. So I start out by sharing an assessment of what I've seen and then what I think we need more of, and then also how I address these issues that I raise. So I've been addressing them already and it gives a little bit of context to some of the ways that I even lead these podcast episodes, but also the services that I offer through my website. And then I even mention a resource as well, which is Public Health Connected, as a great resource for public health professionals. So make sure that you look up Public Health Connected and you follow them on the social media platforms and engage with the resources that are being offered through that platform, through that company, that organization. Let's connect the recording from my LinkedIn Live. And if you have any questions, just reach out to me through our website, drchuntley.com. So let's dive into this topic. I've got some notes on the side, so you'll see me kind of looking back and forth. And that's just, I always have notes when I'm podcasting. I guess you guys are never there with me when I'm recording episodes. So this will be a first. You kind of see how I flow. Although I typically don't really, when I do podcasting, it can be any number of scenes. But this is typically the scene and the setup that I have when I'm recording episodes. Okay, so again, this topic is public health professionals' next steps. I'm going to cover my assessment of the community. We're going to then move into what I think is needed and then how I'm showing up to support my community of public health professionals. So let's just start with my assessment. And really, most of this is focused on this last year. If I were to sum it up, I'd say public health professionals are generally frustrated. For obvious reasons and some not so obvious reasons. I mean, we have been navigating a pandemic for more than a year, but in this last year, there's been so much conversation around burnout, and especially with public health professionals. I think that we often are giving out and serving everyone else, and there's not as much focus back on supporting and serving us as individuals, as professionals. I know that there's an organization that I support that is really focused on helping to target the public health professionals individually as we navigate this kind of pandemic burnout, and that is Public Health Connected. So if you are not already following Public Health Connected on social media, look them up, follow them. They're doing amazing work to support the professional community of public health workers as we continue to navigate this pandemic. But we are, as a community of public health professionals, exhausted as a result of all that we've done and all that we continue to do every day around the pandemic. Another thing is that in sort of explaining this generalization of public health professionals being frustrated is that there are still very limited views of career opportunities in public health. We do know those traditional structures and those traditional opportunities where people go to get their jobs in public health and where they think of doing public health work. But we still have a lot of people who have a very limited perspective, and they don't think that they are doing public health work if they're outside of those traditional structures. And that adds to the frustration of what a lot of people feel right now. There's also this limited view. So if you're working in the health department or the state public health organization or a federal organization that's like CDC or NIH, then you feel confident in saying you're doing public health work. But outside of those areas, a lot of people they struggle to feel that they're doing the work of public health if they're working in, say, the hospitality industry, hotels or restaurants, because they feel that they're not doing the work of public health when it is everywhere. Public health is everywhere. So when you are working in whatever the industry is, you look for the public health implications there. You connect those dots for yourself. But a lot of people really struggle to feel validated that they're doing the work of public health if they're not in state government or federal government. So another thing is a lot of public health professionals with experience and creative ideas, and creative ideas meaning they have ideas about how they want to approach a problem that's not being addressed, or how they want to improve upon something that's being addressed, but it's inadequate. Maybe it's missing a population, a program or offering, or maybe they have a creative way that they could help amplify and improve upon the solution. So they want to offer their expertise through a freelancing platform or through consulting, but they're afraid. So many people are afraid of stepping out and stepping into consulting role for a number of reasons, but that keeps people frustrated because they work in their traditional role. They have all of these years of experience. Maybe it's just what they've seen over time and they know what needs to be done or what could be improved upon, but they are afraid, or for any number of reasons that I've run across, they just are not stepping out and into consulting. They don't feel supported. They don't feel confident. The list goes on. But for those people, because they have so much more to give above and beyond what they're doing in their traditional role in public health, they are frustrated because they have more that they could do. They see that more needs to be done and could be done, but for whatever reason, they're not stepping out to do more, the more that they know that they can do. And then another, still under this general umbrella of public health professionals kind of feeling frustrated, is that we're still very siloed. You know, despite how much we think this word is being overused, it is what it is. We are still very siloed. You know, the academics work with the academics, the researchers work with the researchers, the epidemiologists work with the epidemiologists, you know, the community health educators stick together. So we are siloed. We don't cross over. We don't engage with what one another's doing. We don't have these cross collaboration working groups, or when we do, they don't touch the potential that they could in terms of how we could empower one another and just be informed across the silos, really breaking these silos in public health. So this adds to the feeling of frustration. We just don't know what the other is doing. There's a lot of duplication, just the isolated feelings that go along with that. So for all of these reasons, I think, and I'm not just pulling this all out of my own mind or just sitting around thinking and wondering, these are things that I hear from people that I work with, and I see it and it comes to me. I work with a lot of people individually. I pay attention to my community. I hear what's going on. And these are things that add to the frustration within and among public health professionals. So I'm going to ask you, if you're watching me live, or even if you're watching the replay, if you would just comment, if you feel comfortable commenting, to let me know if any of that resonates with you. I would love to hear from you. You can certainly message me directly if you're not comfortable typing that out. But let me keep going. So under this umbrella of feeling, generally frustrated, of course, I'm always thinking about what needs to happen and what we can do. I also noticed something else, and that is that we still lag behind other industries as public health professionals. We still lag behind other industries in a few ways. We have these inadequate networks, which kind of stems back to the last thing that I mentioned about being siloed, because we are not really breaking down those walls, really engaging with one another across the different categories or industries or niche areas in public health. Then our networks, we may have networks, but they're inadequate. The other thing that kind of goes into that is these inadequate networking skills. So sometimes people are really, really good at it. And this is not everyone, but I think these are things that are it causes us to lag behind some of the other industries. So where we're not really networking with one another, some of our skills are a little rusty. So we throw across the business cards if we happen to be in person, or some people who are in their job, in their role, because they're, sometimes burdened really heavy with the work. There's no time to network, or they don't think that it is being productive to network and engage with others in the work. They're just trying to tick the boxes and do what they need to do, when we're not really meeting new people, engaging, getting to know what they're doing, and even the skills to do so. I cannot tell you how often people will reach out to me still to connect with me, and there's no conversation. Being able to know how you connected with someone, just the hi, hello, how are you? You can still do that. And you should still do that when you're connecting with someone across social media, for example, and you send a connection request, send a message along with that. So those are some of the things that stand out to me as I pay attention, and I always am paying attention to my community, but specifically in this year. So what I think we need more of, based on, my assessment of my community of public health professionals, what I think we need more of is, number one, support and encouragement for creative expression in public health. And this goes across the board. I find that the younger generation, I sound like this old lady now, but the millennials, who sometimes get such a bad rep, I think they have nailed it, because they have an idea, they get inspired, they do it, they take action. And we can learn a lot from that type of energy. Some of us wait to get permission to be creative, and some of us are afraid to step out and be creative because we're afraid of what it will look like, because it's being done differently. How many times have you heard, we do it this way, we've always done it this way, and don't we even question it, it's just the way it's done? I hope that not a lot of you have heard that. Unfortunately, I know a lot of people have heard that. I worked in an environment like that, and I know that that's the way a lot of people think. But I think that we need to really support creative expression in public health. Without a doubt, yes, we're still talking about being professional and respectful, but I think that we need to have a culture among professionals in public health that embraces a different perspective, a different way of doing things, something that's new, and just being open to it. I think that we could go a long way with that. So support and encouragement for creative expression in public health. That can be very freeing for the people who actually step into that. I'm speaking from experience. When I definitely started taking my own creative steps, I felt very odd and very different and very just unique. For me, it felt very negative. Over time, I wear that differently. So I am who I am, and I feel very free to express the way that I want. My podcast is a great example. When I decided to start the podcast, for all the reasons, this was my way of demonstrating the different career paths and the different journeys into public health, and the different ways that people are advancing public health, the mission of that to improve health of populations around the world with their own degrees and their own spin on things. And this was my way of demonstrating that to the community of professionals and the next generation of public health leaders, students, to see a different and hear a different display other than what they got from those few traditional examples. So just in general, support and encouragement for creative expression in public health we need more of that. I also think that we need room to spread our wings and safe spaces. We've got more and more of that coming along, but I think there's room for even more. We need to have these safe spaces for people to spread their wings and test things out and share their ideas and bounce those off of other people and to feel supported and not so negatively isolated and like this is so wrong or awkward, you know. I also think that we need a wider view of the opportunities in this broad field, you know, connecting the dots to other industries with public health. We need more of that. And, you know, generally just more thinking outside the box. That phrase will never get old to me. Really being able to think outside the box is how we are going to be able to make a difference. It's so important. So these are the things that I feel that we need more of. I'm not saying we don't have any of these things, but we absolutely need more of these things based on my assessment of my public health professional community. Now, this is where I get to share with you my spin on things. So these are some things that I'm doing, I've been doing, and I will continue to do. And some of it's a little new, but these are the things that I do and how I address some of these issues and how I show my support for my professional community of public health folks. And first and foremost is the podcast. Public Health Epidemiology Conversations podcast. For those who are watching me live, and if you're listening to me on the podcast, like I'm already listening to you. This podcast is one of the ways that I continue to address some of these issues. You know, this helps connecting the dots in other industries. The variety of guests that I bring on this show, people always comment to me when they talk about what they like about the podcast. I often hear people say the variety of guests, and that's something that I've always had fun with from the beginning. I always get excited when I interview my guests for a new episode. And I can't imagine that ever getting old for me either. So that's one of the ways that the podcast helps support some of the challenges I mentioned earlier and helping you think outside the box about the opportunities. So if we go back to episode 209, which is where I changed the name of the podcast, it was not because I no longer support career-focused direction or people seeking careers. If you remember, if those have been around for a while, the podcast started out with the name Public Health Epidemiology Careers Podcast. And in episode 209, I changed the name to Public Health Epidemiology Conversations Podcast. Slight change, but I did that only because I wanted to break people away from just thinking about a job title or thinking so narrow about the career, but more about the opportunities. So when I changed to conversations, that felt like it opened things up for us to have these conversations that connect the dots, because more people are interested in these conversations that aren't necessarily looking to switch careers, or it's not always about the career. But I think beyond our community of public health professionals, there have been so many people that have engaged with the podcast and have taken so much away from these conversations who are not looking at careers, but they're looking at how public health fits into what they do in their industry. So it kind of breaks some of the walls. And that was a lot of the deep thought around changing that when I made that change. So that's another way that I support some of those, my community in addressing some of the challenges that I talked about. The podcast also supports this creative expression. A lot of my solo episodes, similar to this one, where I put on, I either share a lot of insights and feedback with you, but I often will put on my coaching hat and just really share, especially when a topic comes to light that I know will really help my community. I put on my coaching hat and I teach and share, and just really, I won't say normalize things, but I know that sometimes when people are thinking about, especially under the umbrella of entrepreneurship, they feel like they're by themselves, or it's really scary. So when I put on my coaching hat and I talk about some of these things, it really helps a lot of people who are listening. So this is how I support in that way. So I would encourage you to subscribe to the podcast newsletter. If you're on my website, anything that you opt into will get you on the newsletter. So you'll get weekly updates whenever new episodes come out. And then once a month, we send out a newsletter that lets you know all the things that are going on within our community. Also, if you're listening in Apple Podcasts or Spotify or any of the number of apps that you choose where podcasts are found, just click the follow button so that you will be alerted and you'll know when the new episodes come up. Okay. Another way that I continue to support is through social media. So my business, Dr. C.H. Huntley, LLC, and then I have my personal accounts. So when you follow any of the business accounts across Instagram, LinkedIn, Facebook, Twitter, those accounts will keep you up to date on what's happening with the episodes of the podcast. I'll remind you of some of the older episodes sometimes. If there's anything new, the resources that are offered through the business, any events that are coming up, you'll stay up to date on the resources that are available to support the public health community. If you follow my personal accounts, then you get to keep up with anything that's going on with me that you find interesting. So on Instagram, Twitter, and LinkedIn, I have personal accounts as well. So depending on that platform, it kind of dictates what I talk about. So if you want to hear about personal things like my plant-based diet journey and my family, then Instagram would be the place. My obsession with walking and hiking, then that'd probably be a place to follow me. But if you are more interested in my personal feedback or comments on anything related to public health in terms of business or I really enjoy Twitter chats. So I'm notorious for jumping on some Twitter chat and getting to a conversation. If that's the thing that you like, then Twitter is really definitely a place to hang out. And then probably everything else sort of on the business side of things with a little bit of a personal touch would be LinkedIn. So I invite you to join me in any of those platforms. The one caveat there is my personal account with Facebook is for family only. And honestly, I don't even show up there very often. But everything else, as far as if you want to engage with me, that's kind of how that works right now. The LinkedIn Lives, this weekly LinkedIn Live where I show up at noon. Usually it's 30 minutes. Today will probably be a little longer because I'm trying to complete this recording for our podcast. But LinkedIn Live every day at 12 noon, and that's Eastern time. I'm not every day, every Wednesday at 12 noon Eastern is where I show up to share. Usually it's a entrepreneur related topic. And sometimes I'll update you on things around the podcast. And today I'm experimenting to put together a podcast episode. So I guess you never really know. But for the most part, it's around support for entrepreneurial type of topics, because I know that people are thinking about it and it is really on your mind. So if I just come up front and share it, it provides that safe space and supports you in a way that you don't have to comment, you don't have to, but it's just there. It opens the door for you to comment, and it opens the door for you to connect with me on, direct messages if you have a question or follow up. So that just is some of the ways that I use this platform. But I also know that a lot of my clients, when I coach and work with my clients, I do what I call a LinkedIn audit. And I work with them more strategically about how to use that platform for their business and how to leverage their personal account and their business account in a strategy that helps them to develop these meaningful connections with their future clients and the networks that they want to build. So that is something that I offer right now only with my clients that I work with, but I may offer that to my broader community from time to time. If that's something that is of interest to you, then certainly send me a direct message on LinkedIn and we can talk about that. I will continue to support through consulting. So I offer strategic consulting solutions to businesses, health-focused businesses that are looking to really get to know their communities better and connect with their communities in a way that helps them to increase the impact that they have in their communities that they serve. And we do that with using public health, specifically epidemiology, in a way that's unique to your business. And right now, so many businesses are really aware of public health and epidemiology and would love to incorporate more into what they do. So if you're a health-focused organization and you're interested in a unique strategy that helps you incorporate more of the public health and epidemiology to help you have a bigger impact in your community, I can help you with that. That is really where I've been landing a lot of the consulting work in this year. So that's a way that I support public health in my own creative sphere because it opens up that conversation a lot more in a broader sense beyond the public health industry. It makes public health and epidemiology more digestible to other health-focused organizations. And then finally, I will say I continue to support and address some of these issues by providing coaching services. So I have coaching services available in 3 sort of categories. So for people who are curious, you're not sure about this whole entrepreneurial thing or consulting thing, but you like to know how it works or how it could possibly work for you. You're just curious. That's one way that I help. Another category of coaching, people fall in a category of building. So they've decided they want to start consulting. They want to start their own business, but they have no idea what to do first or what to do next, how to get clients, how to set all this up. What am I going to offer? All the things. They just know that they want to start, but they're not sure what to do next. So that is a category where I help people. And then also those consultants that already have a business. They have a business. They're wanting to level up a bit more. They're wanting to up their goals. They want to be in a community with other public health consultants who are striving for the same type of growth. Then I support my public health consultants in a small group setting in coaching as well. So those 3 areas, if you're curious, you're building, or you're growing, that would be the way I would categorize the different entrepreneurs in public health that I support. And then finally, some people don't want to work in a group. They want to work one-on-one with me. I have clients that are very clear. They want 100% attention on their business, their focus, helping them accomplish whatever the goal is or overcoming a challenge or obstacle. And I work with a very small group, one-on-one, very select group, one-on-one. But if that describes you, the easiest thing to do is just message me on LinkedIn and I can, we can kind of go from there. But that's how I support public health professionals in addressing some of the things that we talked about earlier. One of the easiest ways is to just message me if you're here on LinkedIn and let me know what your needs are and what you're interested in, or you can go directly to my website. If you're watching the video, it's on the screen, drchuntley.com. And there's a tab for consulting. If you're a health business and organization, you're looking in that direction. There's a tab for coaching if that is what you need. And then you can also find the podcast there. Okay, that is a wrap for today. I really just wanted to touch on what I've noticed as far as public health professional community, what I think is needed, and how I am supporting and addressing those challenges and needs. Let me know how I can help you by either direct messaging me or you can visit my website and send me a message there. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.